Preparing for medical emergencies and administering first aid in critical situations can help save lives and minimize the severity of injuries. Here's how to effectively prepare for and respond to medical emergencies. Learn basic first aid skills. Take a certified first aid course to learn essential first aid skills such as CPR, choking relief, wound care, bleeding control, fracture stabilization, and managing medical emergencies like heart attacks, strokes, and allergic reactions. Assemble a first aid kit. Keep a well-stocked first aid kit at home, in your car, and at your workplace. Include items such as adhesive bandages, gauze pads, adhesive tape, antiseptic wipes, tweezers, scissors, disposable gloves, a CPR mask, a thermometer, pain relievers, and any medications you may need. Create an emergency action plan. Develop an emergency action plan for your home, workplace, and any other frequently visited locations. Identify emergency exits, evacuation routes, and designated meeting points. Make sure everyone in your household or workplace knows what to do in an emergency. Know emergency contact information. Keep a list of emergency phone numbers, including local emergency services, poison control, your doctor, and nearby hospitals, in a readily accessible location. Program important numbers into your phone and teach children how to dial 911 in emergencies. Stay informed. Stay informed about common medical emergencies, their signs and symptoms, and appropriate first aid responses. Familiarize yourself with potential hazards in your environment, such as severe weather, natural disasters, or industrial accidents. Assess the situation. Assess the scene for safety before providing assistance. Ensure that the area is safe for you and the victim, and take appropriate precautions to protect yourself from harm, such as wearing personal protective equipment, PPE, if available. Perform basic life support. If someone is unresponsive and not breathing, perform CPR immediately. Follow the guidelines for hands-only CPR if you are not trained in rescue breathing. If an automated external defibrillator, AED, is available, use it according to instructions. Control bleeding. Apply direct pressure to any bleeding wounds using sterile gauze or a clean cloth. Elevate the injured limb if possible and continue applying pressure until the bleeding stops. Seek medical attention for severe or uncontrollable bleeding. Stabilize injuries. Immobilize any suspected fractures or spinal injuries to prevent further damage. Use splints or improvised materials to support injured limbs and protect them from further injury during transport. Provide comfort and reassurance. Keep the victim calm and provide reassurance while waiting for professional medical help to arrive. Offer comfort measures such as covering them with a blanket, providing emotional support, and staying with them until help arrives. Communicate effectively. Clearly communicate relevant information to emergency responders, such as the victim's condition, any first aid measures you've administered, and any hazards or risks present at the scene. Follow up. After the immediate crisis has passed, follow up with the victim and provide ongoing support as needed. Encourage them to seek medical attention for further evaluation and treatment if necessary. By being prepared, staying informed, and knowing how to respond effectively in medical emergencies, you can make a difference in the outcome for yourself and others in critical situations. Remember to stay calm, act quickly, and prioritize the safety and well-being of everyone involved.